Good evening, everyone. My name is David Rode. I'm with the Arthritis Foundation, and thank you for joining us tonight for an Arthritis Foundation Living Well event on osteoarthritis in cooperation and partnership with Radiotherapy Centers of Kentuckiana. Tonight, we'll tackle all things osteoarthritis, from causes and risk factors to treating symptoms and how to manage flares so you can live more fully. Next slide, please. So tonight, you're going to learn lots of different information to help you manage your condition. First, the most important step of tackling any chronic illness is to understand it first. We're going to discuss symptoms, causes, and risk factors of having osteoarthritis and how it differs from other forms. Then we'll discuss how you can manage your arthritis and its symptoms. This will include a variety of self-management measures, medications, and alternative and complementary treatments. Next, we'll continue our discussion by sharing the various resources the Arthritis Foundation has to help you manage your condition and how we can help you live fully with arthritis. And finally, we're going to learn about a new treatment option that's very exciting and is available to you. Next slide, please. If you're here, either you or someone you know is personally affected by osteoarthritis. An arthritis diagnosis can feel overwhelming, but you're not alone in your fight. As the most common form of arthritis, more than 32.5 million adults live with osteoarthritis in the United States. You also have support and community here on this call with the Arthritis Foundation and Radiotherapy Centers of Kentuckiana. When we're finished today, our goal is not only to offer education and management tools, but to encourage each of you to live well with osteoarthritis. Next slide, please. So, introducing myself officially to you, my name is David Rode. I'm Executive Director of the Arthritis Foundation, and I cover all of Kentucky and the southwest part of Ohio and Cincinnati. I've been with the Arthritis Foundation from 2019 to 2020, worked for Shriners Hospitals, and then an orthopedic practice, and back to the Arthritis Foundation. And I returned as executive director because I am in love with the mission of this organization and helping so many of us who have osteoarthritis feel better and have the tools we need to live a full life. I myself do have osteoarthritis, so I'm really excited to hear what Dr. Musich has to say at the end of this program. I have osteoarthritis in my foot, my knee, my upper back and shoulders and neck, and also in my hands. And now I'd like to introduce Dr. David Musich of Radiotherapy Centers of Kentuckiana.
Thank you, David, for the introduction. And I'm Dr. David Musich. I'm a radiation oncologist and medical director for Radiotherapy Centers of Kentuckiana. We are a practice with locations both in Louisville and in southern Indiana. I've been with the practice now for 19 years. And I'm excited tonight to have the opportunity to talk to you about how radiation therapy can play a role in management of osteoarthritis.
Thank you. Let's move to the next slide and let's get started learning about osteoarthritis, some basics. So historically, osteoarthritis, or OA, as I'll refer to it as, was known as the wear and tear condition, generally associated with aging. But we know now it's a disease of the entire joint, including the bone, the cartilage, the ligaments, fat, and the tissues lining the joint, or the synovium. Osteoarthritis can degrade cartilage, change bone shape, and cause inflammation, which results in pain, stiffness, and loss of mobility. And if you have it, you know what I'm talking about. So when treating osteoarthritis, we have to consider the way the joint is loaded and other factors: injury, joint trauma, obesity, genetics, and anatomical considerations, all those things that affect the joint's alignment. OA is different than most other common forms of arthritis like rheumatoid or psoriatic arthritis, those are autoimmune in nature. And this means that in those forms, the autoimmune disease mistakenly is attacking the joints. Next slide, please. So, how to live well with OA? It's not a disease that has a one-size-fits-all care solution. Like most other forms of arthritis, it's a combination of lifestyle changes, medication, and medical coordination can offer our bodies the best chance at getting and staying healthy. Lifestyle, physical activity, weight management, and eating healthy are some of the most important and beneficial ways to manage OA. We can also use medications. Both prescription and over-the-counter medications may be used to reduce pain and decrease inflammation. And coordinating healthcare providers is also important. Doctors are the pros. Lean on them for understanding and create a partnership that can help create a healthcare plan for you. But remember, while your doctor may be an expert in arthritis, you are an expert in you. If you feel uncomfortable about any part of your care plan, or you have ideas or questions, make them known and let your doctor know where you stand and what you want to know. He or she can work with you to create a treatment plan that's both comprehensive, safe, and effective. Next slide, please. So let's talk a little about self-management. Practicing healthy habits can slow down the progression of OA, keep you healthier overall, and delay any surgeries as long as possible. It's important to pursue a number of different self-care approaches simultaneously, including diet. There's no special diet for OA, but there are certain foods that can cause joint inflammation to be worse, or other foods which can calm down your inflammation. Related to this is weight management, and we never like to hear about weight management, but it matters. Excess weight puts additional force and stress on weight-bearing joints, including the hips, knees, and ankles, the feet, the back, and then fat cells promote inflammation. Losing extra weight helps reduce pain and slow joint damage, and it does that because every pound of weight lost removes 4 pounds of pressure on lower body joints. And even losing small amounts of weight can help. Every pound of weight lost equals 4 pounds of pressure being lost from the knees. So for example, losing just 10 pounds can reduce up to 40 pounds of pressure on your knees. A 2017 study published in Radiology looked at MRI images of osteoarthritic knees in 640 people who were overweight or obese. Participants who lost weight over 4 years, and that's not overnight, that's 4 years, showed significantly lower cartilage deterioration. The more weight lost, the lower the rate of disease progression. Next slide, please. And then there's exercise. Movement is medicine. We've heard that before, and it's really true. Movement reduces pain, improves mobility, slows down disease progression. And while you may worry that exercising with OA can harm your joints and cause more pain, people can and should exercise when they have osteoarthritis. And in fact, research consistently shows that exercise is considered the most effective non-drug treatment for reducing pain and improving movement in patients with osteoarthritis. It can also reduce or slow down disease progression. Now, it's recommended that people with arthritis be moderately physically active for at least 30 minutes per day, 3 or more days per week. Now, as I think about that, that's really not that much, because examples of moderate physical activity can include walking briskly, mowing the lawn, dancing, swimming, bicycling on level terrain. And don't worry if you can't do 30 minutes in one session. It can be split up. You could spread throughout your daily routine, swimming 10 minutes in the morning and riding a bike for 20 minutes later. Or what if you took 3 walks that were 10 minutes long each throughout the day? It's important, however, always to check first with your physician before starting any new exercise program or making changes to an existing one. They're your partner in your care. And when you're ready to start a physical activity program, the Arthritis Foundation also offers plenty of information and resources that can help you find what's the best way for you to feel. A good exercise program to fight OA pain and stiffness has 4 parts. One is strengthening exercises, which builds muscles around painful joints and helps to ease the stress on them. The next is range of motion exercise or stretching, which helps to reduce stiffness and keep your joints moving. Aerobic or cardio exercise can improve stamina and energy levels and reduce excess weight. And balance exercises are also important, helping to strengthen small muscles around the knees and ankles and to help prevent falls. Next slide, please. So let's talk a little bit about physical activity and ways we can be active. It's really important, but we understand that getting started isn't easy. So simple exercises like walking are really effective for management of arthritis and a great starting point to get started on an exercise routine. And even then, walking can be difficult for osteoarthritis patients if your hips, knees, ankles, and feet are affected by the arthritis. The Arthritis Foundation developed a Walk with Ease program. It's a community-based physical activity or self-management education program. While walking is a central activity, Walk with Ease is a multi-component program that also includes health education, stretching, and strengthening exercises, along with motivational strategies. Studies by the Thurston Arthritis Research Center and the Institute on Aging at the University of North Carolina show that Walk with Ease is proven to reduce pain and discomfort with arthritis, to increase balance, strength, and walking pace, build confidence in your ability to be physically active, and improve your overall health. It's offered either as a self-guided course or in a community setting, and you can always choose the format that best suits you. Or just walk your own way. Walking itself is a terrific form of exercise. Next slide, please. Medications are something we all hear a lot about, and they can be a good part of the self-management puzzle. So let's explore a few options that are at your disposal. There are several medications that may help you. Some are over the counter, others need a prescription, and they can be pills, creams, lotions, even injections. And here are some and how they work. Analgesics. So these are medicines that relieve pain, but they don't reduce inflammation. They work to change how your body responds to pain. Some popular options include acetaminophen, tramadol, or prescription opioids containing hydrocodone or oxycodone. NSAIDs are drugs that reduce inflammation as well as reduce pain. And they're some of the most popular medications given for arthritis and include aspirin, celecoxib, ibuprofen, and naproxen. Then there are cortisone shots, and these are powerful medications that reduce swelling and suppress the immune system. My mom actually gets these for her knee arthritis. Your doctor might give you a prescription for a pill, or your doctor might inject it directly at the site of your pain. These injections work quickly, so they're good for short-term relief. The effects can be felt in a few days and they'll last for about 2 months. But they can also create problems like weight gain, cataracts, high blood pressure, and if you need to take them for a long time, your doctor may only have you take a small amount. Then topical medications can be applied over the skin, over a painful joint to temporarily reduce arthritis pain. And some examples are methyl salicylate and capsaicin. These types of topicals are called counterirritants, and this means they activate pain sensors in the skin, and that causes them to be less sensitive to pain signals. And finally, we've all heard about opioids, and they are painkillers that have to be prescribed by a physician. They're very strong and they can work well for severe pain, but they do have more side effects than acetaminophen, and people can become dependent on them or addicted. And experts warn they're not much more useful for long-term use than acetaminophen or NSAIDs. So it's best to avoid those if possible. Next slide, please. So now let's get into the nitty-gritty. Let's work together with our doctor. Because OA is a degenerative, currently incurable disease, Once it's diagnosed, patients will likely feel the effects the rest of their lives. And so we want to manage it. And that's why it's important to have a primary care doctor, an orthopedic doctor, or a rheumatologist that you're able to easily communicate with and understand. Connect with your insurance company or an OA network or community for a suggestion of providers. Everybody has a different experience with arthritis. So honest and thorough communication with your doctor is essential to ensuring that you're getting the right treatment. The better you are at communicating with your doctor, the better your chances are at getting back to feeling like you again. Next slide, please. So how can we communicate best with our doctor? Be upfront. Let your doctor know at the beginning of an appointment that you have issues you want to discuss, or if you have questions, so that time can be devoted to that. Also, be completely honest. If you feel the treatment's not working, say so. You're not going to hurt the doctor's feelings. Not every medication works for every person, and adjustments can be made. And be open. There's no need to be shy. The relationship you have with your doctor is a trusted, confidential one. So you can open up to him or her about what you're feeling and experiencing, and they likely can offer a solution to try. And be assertive. If you don't understand something, ask for more explanation. Believe me, your doctor wants to make sure you understand as well. The conversation is all about you and your best interest. You are your own best advocate. Next slide, please. And when the time comes, and it might, if your disease continues to progress, you and your doctor may decide to discuss surgery. And there are some surgeries that can treat osteoarthritis. While regular exercise and a healthy weight are still your best defense against arthritis pain and disability, if your joints do go past the point of no return, surgery may be an option. Having a basic understanding of common surgical procedures can help you to have an informed discussion with your doctor about which type might be best for you. Different types of surgery include arthroscopy, which involves small incisions, specialized instruments, and a tiny camera. And it's used to fix tears in soft tissues around the knee, hip, shoulder, and other joints. This can repair damaged cartilage and ligaments, and it can remove broken, free-floating cartilage pieces. Then joint resurfacing is, unlike total joint replacement, a procedure that just replaces part of the joint. And for example, in the hip, the socket can be replaced with a metal cup, and the damaged hip ball is reshaped and capped with a metal dome-shaped prosthesis, like a crown on a tooth. Osteotomy is a procedure involving cutting and removing bone and adding a wedge of bone near a damaged joint to help shift weight from an area damaged by arthritis to an undamaged one. Arthrodesis or fusion is a surgery where surgeons use pins, plates, rods, and other hardware to join two or more bones in an ankle, wrist, thumb, finger, or the spine to make one continuous joint. Over time, the bones will grow together and lock that joint in place. And finally, robotic surgery, which is very common now, using robotic-assisted technology. It can often cut recovery time in a joint replacement, and it may lead to longer lasting and more comfortable fit. Next slide, please. And finally, what's really important is complementary management, putting all of these things together. And there are other treatments that can be used as part of this. For example, acupuncture may curb pain by boosting the amount of natural painkillers your body makes, which are called endorphins. Acupuncture is a form of traditional Chinese medicine which aims to correct imbalances of energy in the body. And to do that, practitioners use very fine stainless steel needles to stimulate the body's 14 major energy-carrying channels or meridians. Physical and occupational therapy can help you get moving safely and effectively. Therapists are licensed professionals with graduate degrees and clinical experience who examine, diagnose, and treat or help prevent conditions that limit the body's ability to move and function in daily life. Therapy focuses on the body's ability to engage in movement, Anything from getting in and out of chairs to climbing stairs, walking in your neighborhood, playing a sport, or doing recreational activities. Meditation or mind-body exercises include yoga, tai chi, walking meditation, and all of these can be helpful. Then there are supplements, and there's limited evidence that tells us that vitamin D, herbs, and other supplements can be an effective add-on to your arthritis treatment program, along with medications your doctor prescribes. Yet with thousands of products available from hundreds of different manufacturers, it's hard to know which ones really work. Before you buy any supplement, make sure it's safe and worth the cost. Ask your doctor and your pharmacist whether it's safe and appropriate for your type of arthritis. And find out what dose to take and what side effects to watch out for. Your doctor or physical therapist may recommend short-term bracing as well to help alleviate your arthritis pain. And now I'd like to turn it over to Dr. David Musich, who will tell us about an exciting new treatment option that is available. Next slide, please.
All right. Well, thank you for all the information introduction, and I'm excited to share what we can offer in treatment of osteoarthritis with radiation therapy. And if we can go to the next slide, please. I'd like to actually start with a short video about one of our first patients and their experience.
Last 10 years, I've suffered with osteoarthritis. Every day going up and downstairs was torture. Playing with my grandkids was excruciating. Picking them up, it was always painful. Work was torture on my knees. They always felt like they were going to explode.
Many patients only think of radiation therapy as being used for malignant conditions and cancers, but radiation therapy also has applications in non-malignant conditions such as osteoarthritis, but also including Dupuytren's contracture, Lederhosen disease, plantar fasciitis, and tennis elbow. A patient may want to consider low-dose radiation therapy for their osteoarthritis if they are having worsening symptoms and a worsening quality of life in spite of other treatments such as NSAIDs, steroids, and joint injections, and also if they're not a good candidate for surgical options. Risks of radiation therapy for osteoarthritis, thankfully, are quite low. In most patients, there will be little to no symptoms experienced during or after the course of treatment.
I would strongly recommend this over a complete knee replacement for somebody that's not advanced in years of age. I feel like this has given me a new lease on life, freedom to do things that I would hesitate to do before. Couldn't do that. Not grabbing and pulling on everything to get up and down, or say I'm not going to do that because I know it's going to make my knees hurt for 2 or 3 days after that. I don't have to take aspirins no more to function every day. If I'm going to have a bunch of yard work to do, the inflammation in my knees is gone. It's no longer a struggle to play with my grandkids, getting down to pick them up or chasing them up and down a hill, playing with them in the yard. It was a blessing to find radiotherapy centers of Kentuckiana for my treatments for my osteoarthritis in my knees.
All right. Well, I appreciate your patience through some of our technical challenges there. And I think we can go to the next slide. And I did want to just say that, maybe to start with just a historical perspective for our listener or our attendees in this webinar, that use of radiation for osteoarthritis, although it's something that's a more recent introduction in the United States, it's in fact been used in Europe and particularly Germany for quite some time, and it is actually a mainstay of treatment for osteoarthritis in Europe. And we can go to the next slide. And osteoarthritis has, as David alluded to earlier, many options for management. So I look at radiation therapy as another tool in the toolbox. We're not there to replace any other option. And it's really a matter of, the right treatment at the right time for the right patient. This is a treatment that we think is best used in a relatively early stage of osteoarthritis, but maybe when over-the-counter medications or even some of the topical steroids may not be working as well, or maybe when joint injections have been tried and are no longer working as well either. The studies that have been done do show that for later stage patients that are probably already on the verge of needing or really needing a joint replacement or surgical intervention, those patients are maybe a bit too advanced to really derive as much benefit from radiation. We really think that it's patients over 40 or ideally over 50 that are the best candidates. And realistically, given the age at which most people start developing osteoarthritis, that will include most patients. It can be used for any joint in the body, the hands, fingers, knees, hips, ankles, shoulders, spine. I think most commonly our experience has been with knees and shoulders and hips, but we've also treated hands and I think even one foot case. In addition, there's patients who, they may have the need to have surgery eventually, but radiation may allow them to hold off on that for some time. And as David said in his introduction, a lot of people have osteoarthritis in multiple joints, and certainly we can address multiple joints over a course of treatments. And we do have the option that if the initial round of treatment didn't get the desired level of relief, we can always add a second round of treatment. And we can go to the next slide. Like many things in medicine, there's multiple approaches to how to deliver a course of treatments. This is typically in the range of 5 to 8 treatments, which is delivered every other day over about 2 to 3 weeks. The time to deliver a treatment is relatively quick. If we're addressing one joint, it's probably going to be a patient in the room for less than 10 minutes. Certainly if we're treating multiple joints, it'll take a little longer. You don't actually feel anything at all during radiation therapy. And in particular, because we're using quite low doses of radiation compared to radiation therapy for malignant conditions, the side effect profile is very good. And in the vast majority of patients, there's not going to be any significant acute side effects. And really, there's no activity limitations, and patients continue all their normal activities. In our experience to this point, I don't think we've had anyone have any acute side effects that I'm aware of. And we can go to the next slide. As far as expectations, and maybe to go back to reflecting on one of the initial slides, a lot of the things that we can do for osteoarthritis are things that address symptoms, such as medications can address symptoms, diet and lifestyle changes can address symptoms. I think radiation therapy is unique in the fact that we are actually directly addressing the inflammatory process in the joint. And so we are actually, hopefully halting the disease process itself. We're not reversing it, but at least halting it for a time. Studies can show pain improvement rates of up to 70%. And those can be very durable responses of up to several years. That does allow patients, as our video demonstrated, to have a better lifestyle. They're able to do the things they love to do and not be restricted by pain. In addition, it could allow them to decrease or discontinue NSAIDs or other medications, or at least minimize their use. And those medications themselves are not benign, and they have potential serious side effects as well. Patients may be able to delay needing surgery, and so that gives them time, away from the limitations that surgery can impose. And we can go to the next slide. As far as costs, I'm going to, for a moment, allow Nicole Blevins, who is our practice manager and also a licensed radiation therapist, to touch on some of the cost and insurance issues. Nicole?
Thanks, Dr. Musich. So most insurances cover the treatment. So when you come in for a consult, we have financial counselors that work here, and they will run your insurance, and we will be able to tell you an upfront cost. So most of the time, that's just you meeting your deductible or your copays. If you did have a self-pay and no insurance, typically the entire cost of treatments are anywhere from about $2,000 to $4,000. It just kind of depends on what area we're treating and how many treatments you're prescribed. Next slide, please. Also, just wanted to touch on, like, why should you choose us? Why us? We have 2 centers, one in Louisville, Kentucky, and one in Jeffersonville, Indiana. Both are very easily accessible. It's also very nice to be at an outpatient clinic because you get to park right in our parking lot and walk right in. You don't have to pay to park or go through a parking garage and go through a long hospital trying to figure out where to go. We have great equipment. We have new machines at our Jeffersonville office. And then also, a lot of times when you come to an outpatient facility, you're going to end up paying a little bit less than you would if you went to a hospital. So we are also backed by the U.S. Oncology Network, and we have a lot of providers and over 160 different sites around the U.S. Dr. Musich, I can hand it back to you.
Thank you so much, Nicole. And I'm not sure if there's another slide. Oh, and so in addition to myself, we have 2 other radiation oncologists in the practice, Dr. Lawrence Hockman and Dr. Matthew Forstoffel. We're all board-certified radiation oncologists and have a long range of experience amongst the 3 of us, and all of us are available for treatment of osteoarthritis. And I'm happy to open this to questions.
I could just speak to the radiation therapy part of it. Is, when you come in for your treatments, it's very easy. You just kind of lay down on the table as you saw in the video. We have lasers in the room that we line you up to, and it's very, very quick. If we're treating just one area, you could be in and out in as little as 10 minutes. So it
And
looks like we have a question about how long it takes before you can be seen. And we can get you in for a consult usually the same week. At most, it would be the following week, but we can get you in and get you in for a consult. No need to wait a year to get an appointment. No, not at all. We can get you in, seen, and then from there, if you decided that you wanted to have treatments, we go ahead and get you in to what's called a CT scan. It's a little bit different than a normal CT scan that you've had previously. This would be just to be able to plan your treatments. Let's see.
And we were getting additional questions now. As far as available for people in other states, certainly we're part of the U.S. Oncology Network. So as Nicole pointed out, our network is 160 sites in multiple states in the country. And so if you went to the U.S. Oncology Network website, there's ways of finding locations near you. Certainly there's lots of radiation oncologists not associated with our network that you could reach out to and see if they are offering low-dose radiation therapy for osteoarthritis. And just to reflect back on what I'd said earlier, it is a kind of relatively newer practice in the US. So although I think it is expanding amongst practices in the US, it's not necessarily the case that every practice is going to offer that as an option. So you're going to have to just reach out and see locally what's available in your area. How many treatments for osteoarthritis of the knee? And typically that would be 5 to 6 treatments every other day. So that would be over the course of approximately 2 weeks. The duration of pain relief, again, like many things in medicine, your experience can vary, but studies do suggest that there are patients that can have pain relief for up to 2 years. And I'm going to qualify that with saying that many of the studies showing good results did somewhere around 40% of the patients went through a second round of treatment. So if the first round does not give adequate relief, certainly a second round of treatment, usually within, a month or two is something that can also be offered. As far as activity restrictions, again, there's no activity restrictions whatsoever with this. It's simply the logistics of you coming for your treatment. Given the fact that there's virtually no acute side effects with this, it shouldn't restrict even your activities immediately after treatment. In addition, maybe one thing that we hadn't pointed out is it won't limit the ability for other treatments to be used in the future. So by doing low-dose radiation therapy, you still are able to do medications, topical medications, injections. It does not limit surgical options. So the only time any radiation is present is when you're on the table and the beam is on delivering the treatment. You will never, become radioactive from this. I think there was another insurance question.
Yep, I see a question about getting it approved by insurance. We have not run into really any issues getting it approved by insurance companies. Medicare has paid for it. So yeah, it's been very easy to get these paid for if you have insurance. Like I said, you would just be looking at your deductible or copays, whatever you usually have.
Yeah, and to add on to that, I think it has to do a lot with us on our end submitting this correctly and coding this correctly. But if we do that, our experience has been it gets paid for.
I do want to also add that a lot of the patients that we've seen, have experienced immediate pain relief after just like a couple of treatments. So they're already starting to feel the effects just right after, 2 treatments. And the most of the time they say when they wake up in the morning, they notice that they're in less pain than they were typically. I think we got another question too. Is there any medical conditions, Dr. Musich, that would make a candidate not be able to be treated? Like it says like diabetes or heart disease.
There are, I think, very few limitations on what would make a person not a candidate. I think certainly the osteoarthritis itself, again, if it's fairly advanced and surgery is imminent, it's a lot less likely that we're going to offer substantial benefit. It may still give some temporary pain relief, but if surgery is that imminent, it may only just give some relief until the time of surgery. I think there are, patients who are younger, patients under 40, we're going to really not want to treat. And that's just out of an abundance of caution that although there is a theoretical risk of increasing the risk of a second malignancy with radiation therapy, that is something that we're really concerned about in younger patients. And the reality is it's really in pediatric patients, but the recommendation is to, out of an abundance of caution, to limit this to patients over 40 or ideally over 50. There are some rare autoimmune diseases that may be a relative contraindication as well. As far as who is delivering the treatment itself, it is in fact not the radiation oncologist. So it is the radiation therapists who are all have degrees in radiation therapy and are board certified and licensed to do the actual setup of treatment and the delivery of treatment, and that's the case throughout the entire United States.
I think that's all the questions.
On the screen right now, you'll see a list of resources for living well with pain. These are all through the Arthritis Foundation website, which is arthritis.org. And then you'd have /podcast or /webinars and so forth. Arthritis.org is a website with an awful lot of information and sometimes takes a while to figure out how to navigate through it. But if you look at the menu across the top of the main screen at arthritis.org, there's a wealth of educational information. There's nutrition information, cooking, recipes, as well as treatment. But I just want to say how excited the Arthritis Foundation is to be able to partner with radiotherapy centers of Kentuckiana to provide this information. As I said, I'm excited to learn about it. And I just think it's great to be able to share it with so many other people. So Dr. Musich and Nicole, thank you for your part in this. Looks like we've got another question in the chat, so I'll let you take that.
There was a question about seeing the machine prior to treatment. And that may be an option, just depending on how busy the clinic is when you came for consultation. If there was time between patients, it may be possible to take a look at the machine. And in fact, on the video link, which is on our practice's website as well, the video of our patient, in fact, you can see the machine in that video of him being on the table and being positioned. So that is in fact from one of our treatment rooms. You know,
If they
and
want to go on our website and they can see our machines and everything on there too.
and maybe just to, you know, tie in what the process would look like is that you would have a consultation with one of the physicians in our practice. And if you elected to proceed with treatment, there is a planning step that we do prior to treatment where we do a CT scan of the joint we're going to treat so that we can use that to map out exactly how we're going to deliver radiation to that joint. And then at the time of the CT, we also get you on the treatment schedule, and you'll typically have the same appointment time for every treatment for the full course. And then typically we'll meet with patients once or twice over the course of their treatments, depending on how many treatments they're getting. And we would probably like to see patients back and follow up within a month or two to see how they're doing. And that way we can see if the first course of treatment was adequate or do we need to consider a second course. And then, you know, certainly the use of radiation therapy for osteoarthritis and a lot of benign conditions is very common in Europe and particularly in Germany, where they've been very good about establishing study groups and working groups to establish guidelines and exactly who to treat and how. And so a lot of, in fact, of the data we use to support what we do is from these German and European studies. All right.
Thank you.
Dr.
Well, thank you so
Musich
much.
and Nicole, I want to thank you very much. And Asia behind the scenes running the PowerPoint, thank you for your help. To everyone who attended, I want to thank you as well for taking the time to learn about this. I think this is fantastic, exciting, and all of us are available to answer questions anytime if you should have some later on. So thanks to everyone for their time this evening, and I hope you have a good rest of your evening.
Thank you for the opportunity.